Somebody asked about our relationship, I think, with the South African Medical Association. Since they were a party to the case, along with the TAC, I think it's pretty clear that our relationship with them is not good. Does it need to be good? That's an interesting question. It doesn't need to be. To do what we're doing, we don't need their help. This is a community program. This is about you, the people in the community. This is not about them. Would it be helpful if we had their support? Yes, probably. Why would it be helpful? Well, it may mean that the program may be more widely accepted, that more people may get access to it. But I think it's clear from what we heard from our MEC earlier today that that's not going to be a problem in KZN. The support is there. It can't happen overnight, much as we'd all like it to. There are lots of administrative problems to overcome. There are lots of resource problems to overcome. But we'll work on them, together with our partners, and perhaps, who knows, even with some direct support from the MEC and her department. The other question that was asked was about the ruling itself and whether there will be an appeal against the ruling. As you perhaps guessed from what I said earlier, we've taken some time to look at the ruling in detail together with our legal advisors, and I can tell you that we will be appealing. We're not going to give up here, folks. If successful in that appeal depends on a number of factors. As I mentioned earlier, the ruling doesn't stop us distributing the VitaCell product, so that's a positive thing. However, as it stands at the moment, it may stop us doing some of the other important things that need to be done. So we'll work very hard on that appeal. But what would really help us, as our MEC said earlier, is your support. What can you do? Well, really, just simple things. Try to encourage your community to give wider acceptance to this program. In Cape and other places. And to be really honest with you, the support from the community varies. In some places it's really good. Everybody in the community is behind it because they see the benefits, not only for those people who have disease, but for the community as a whole. Remember, this is not just about VitaCell, this program. There are other elements to it too. There's the community gardening element, for example. This is a program that's designed to help communities improve not only their health, but their standard of living too. If it can gain wider acceptance within all the communities, then that will help us more than anything else. And who's best placed to do that? The people that live there. So I would reinforce the MEC's call for your support, wherever you can give it. I hope I've answered all the questions that you had. I'm happy to take a couple more if we have time. Okay, we don't have time. Okay, so I thank you very much for your support. I thank you very much for inviting Dr. Jarawala and myself here today. We're very honoured to be here, and Aluta continua. Amanda.